All right. Welcome, everybody. My name is Max, and I'm joined with my colleague, Taylor, and we're really excited for you to join us on our AI for Healthcare Marketing webinar. Before we start, there is a Q&A box where you're welcome to drop in any questions that you would like to put in there, and we'll try our best to answer them live or at the end of this presentation. Before we get started, this is a healthcare marketing deck, and we do talk a lot about HIPAA, so I do have a legal disclaimer to kind of walk through. That is the information that is contained in this communication should not be construed as any legal advice on any matter. Wheelhouse DMG is not providing any legal opinions regarding the compliance of any solution with HIPAA or other laws and regulations. Any determination as to whether a particular solution meets applicable compliance requirements is the sole responsibility of the client and should be made after consulting with their own legal counsel. So we thought we'd do something fun and introduce each other. So Taylor, go ahead and go for it.
Awesome. Thanks, Max. And thank you all for joining today. So you're going to hear from Max and myself. Max is an expert in SEO, PPC, CRO, and Python. He's basically a wizard around these parts, and he does a lot of really innovative stuff for some of our biggest clients, including NASA and Fred Hutch Cancer Center. So he's going to walk us through a GPT model that includes a SERP scraper that I think you'll find really interesting, as well as an inbox monitoring solution that he helped create for another one of our clients. But Max is incredibly intelligent and has done some really cool stuff for us at Wheelhouse, and I'm excited to present this with him today.
Thanks, Taylor. And I'm joined with Taylor. He's a senior SEO strategist here at Wheelhouse with over 6 years of experience. As a senior strategist, he leads engagement with some pretty core clients of ours, including one of Washington's largest healthcare providers. He's also the creator and owner of Lighthouse, one of our proprietary search intelligence platforms that enables us to analyze search results. He's also one of our other pioneers in AI. He's developed custom GPTs at Wheelhouse that have helped increase efficiency and driven significant value for our clients. I'm really happy to be joined with you, Taylor.
Nice.
All right, so we're really touching on just 3 core topics. Practical use cases for AI in healthcare marketing. This will include utilizing private LLMs when working with PHI, utilizing custom GPTs to scrape and understand the SERP landscape, harnessing ChatGPT's knowledge base of niche subject matters and audiences. And then we'll also take a look at a theoretical use case for ChatGPT as a content assistant. So at Wheelhouse, we believe AI is here to empower our marketing team, streamlining tasks efficiently so we can focus on crafting strategic big picture initiatives. And we'll look at a lot of those examples in this case, but first we'll start off with our signal from noise. So our first use case features work that we've been doing for one of the largest nonprofit health systems in the United States. We've been working with this client for over a decade on projects spanning advertising, analytics, and engineering. But late last year, they asked us to help them build out an approach to leverage AI and LLMs in a compliant way. So we've worked with them to design and build our first use case called signal from noise. The key requirement here was that it had to be compliant and able to process PHI safely. So this model is designed to ingest data, review or evaluate data, and then also act based on the output of the review. In this case, we're ingesting emails from a specific inbox, which receives like a high volume amount of junk, but it could also receive stray patient emails. Emails can be sent to this inbox that contain PHI, which means that this needs to be built in a private and compliant environment. We then send those emails to a private LLM for evaluation based on a modifiable task. That includes application-specific and task prompt criteria for the AI. The response from that task is then sent to our central agent to validate and then act based on the rules we provided. So in this case, our proof of concept triggers a team notification based on a RACI model for that given output. So where do we build a model that is compliant? And that would be Azure. First, it's customizable. You can modify prompts and actions to quickly deploy various use cases like IT, junk spam, and handling former employee inboxes. Second, the team notification can share the subject and message, updated to use different data or content, and then AI can actually summarize long emails. But most importantly, this model is HIPAA compliant. So patient emails, names, numbers, and other PII can be handled securely. since we operate within that secure closed environment. This Azure architecture diagram highlights key features of Azure's AI functions, offering a serverless, event-driven, and scalable compute with infrastructure management. It integrates Azure AI services and custom machine learning models. It supports multiple programming languages like Python, C#, and JavaScript, and it provides a streamlined AI model deployment process. Functions are activated by various events and connect to other Azure services through triggers and bindings. The architecture automatically scales based on demand, and it uses a pay-per-execution pricing model. It only charges for compute resources used. These features enable seamless integration of AI capabilities into healthcare applications using Azure. Lastly, optional elements include Azure Logic apps for complex event actions, queue services for managing high volumes of notifications, and custom Azure functions for adding AI or traditional processing to any workflow. So now that we've explored the secure and compliant AI use case built into Azure, let's pivot to other applications that you can actually try on your own. And the first use case is our SERP crawler. So in the past, SEOs had to manually sift through keywords and analyze SERPs. But now with AI, we can actually automate this research, examining search intent, SERP features, and related queries to swiftly generate comprehensive content recommendations. This revolutionizes SEO by delivering faster insights with unprecedented efficiency. So to build this SERP crawler, the tools that I used were ChatGPT. I built out a custom GPT that interfaces with SERP API. SERP API receives a crawl request from our customer GPT, and then it returns a JSON formatted SERP page that includes organic and paid results, rich snippet data. People also ask local results and everything else. And then OpenAI actually has an action GPT where you can take the curl request, throw it in there, give it some criteria of what you're looking for, and it'll spit it out. And after a couple workarounds, you can get it working without having to go in and manually type all that stuff out and hope that it works. So looking at some use cases that I've used for the SERP crawler are content gap analysis. The result is a pretty powerful SERP tool. So we can use this for results based on like locations. We can actually upload CSV sheets with terms and ask for an analysis. We can use it to surface more keywords and a lot of other use cases. In this use case, we utilized it to run a content gap analysis. We sent it a URL of our current near breakthrough page. And then we asked it to research not only just that list of keywords that you can see on the screen, but also follow the links of the top 5 results for each result or each keyword, and then recommend content that we could include in our near breakthrough page that would help improve our performance. And to the left there, you can see that it recommended a detailed explanation of cell division and tumor growth rates. It was looking for more specific information on aggressive cancer types like triple negative and HER2 positive. There was an emphasis on the importance of regular screening and types of mammograms, and then also just looking to include more data and statistics on tumor doubling times. Another use case that's not in my wheelhouse was a Google ad builder, but we asked it to kind of look through all the ads that it saw within a list of keywords. And what I did find too when prompt engineering in past projects was that when you ask it to identify patterns and then actually spit out what it's identified, it helps build out a more thorough content plan. So in this case, my prompt was to identify any patterns and write me a few copy ideas that included a title, an 80-character body, and 2-word call to action. And its analysis was that all ads emphasize healthcare-specific applications of AI chatbots. It saw patient engagement, medical consultations, and process automation. Ads highlighted benefits such as improved patient experiences, intelligent automation, and streamlined process. Many ads reference established brands and mention industry recognitions. And then it also spouted a few kind of common call to actions. And at the right there, I'll give it a little bit, but you can kind of see some of the ad copy ideas that it came up with. So moving on, I'll pass it over to Taylor, but we're going to talk about understanding your audience.
Nice, thanks. So I want to go through a couple use cases that I use on the day-to-day. Basically just ways you can leverage ChatGPT or another LLM's knowledge base to really just expedite your research and get the ball rolling on different projects you might be working on. So this first one, understanding your audience. So like I said, LLMs like ChatGPT have really extensive knowledge bases. And in my experience, they're surprisingly good with understanding different types of patients, what they deal with on the day to day, and what they care about when they're looking for care. Um, so some ways I've used it is really just asking it, what do people with a specific condition care about most when they're choosing a healthcare provider? I found that when you're working for a healthcare network, they have so many different specialties, so many different treatment options and conditions that they treat, that really putting yourself into the shoes of a patient is kind of difficult and time consuming. There's so much research out there, and you can really dig into what it's like living with a certain condition. Um, and ChatGPT in particular is really good at summarizing what those patients deal with and what it's like living with a specific condition. So taking that a step further, say I'm creating a web page for a specific demographic with a certain condition looking for a doctor. I'll ask it to help me outline that page. I'll give it as much context as I can, but it does a really good job at crafting content that'll speak to a specific audience really well. So if you're, trying to reach an athlete who's looking for a PT for some, bad injury that they had, you're going to want to speak to different things than if you're trying to reach people looking for an OBGYN. Really putting yourself into the shoes of the audience is key for crafting great content, whether that's for a website or social media or an email campaign. Um, so I've also similarly asked it for common misconceptions about certain diseases, specifically for social media ads. That's a good way to catch people's attention, but you really just can leverage ChatGPT's knowledge base to not only figure out how to speak to people, but try to catch their attention with common misconceptions. Um, and so another one I've used. Um, so as you're probably well aware, in healthcare and really in any industry, you often get a lot of research papers, customer surveys, and different reports that take a lot of time to comb through. If you haven't played with custom GPTs and ChatGPT, I highly recommend it. I'll go into one example in a second, but another one that I've used is taking dense research papers and feeding them into a custom GPT. So then I not only have to, or I no longer have to go through the research papers page by page by page and pull out insights. I can simply upload those documents to a custom GPT and then just talk to it and ask it questions. In the custom GPT instructions, you can tell it to cite your sources with page numbers and things like that, so I can go fact check it. But essentially, I've saved dozens of hours taking really dense research papers, putting them into a custom GPT, and basically turning it into my own chatbot on that research. I will warn that if it is proprietary or confidential information, you probably shouldn't be uploading it to ChatGPT. But if it is anything public and you don't want to spend hours combing through dense research data, I would recommend a custom GPT. It really saves you so much time, and basically takes the role of an intern or anyone else who would just manually comb through dense research papers to find interesting findings. I've used this to say, I'm trying to speak to this demographic in this region, based on their most important factors when choosing a medical device. What should I be speaking to? And it cites that research paper and saves me hours and hours of time. So this next example is going to be a custom GPT, but this will be for a specific use case. And really with custom GPTs, you can tailor the outputs to whatever you need. So if you're making social media campaigns or email campaigns or creating web pages, you can make a custom GPT that gives you the output in a format that you need to be able to expedite your work. In this example, so we create content briefs. When we're creating website content, we'll put together a whole outline with all the SEO elements and really outline the page in detail to hand off to a writer who works with medical experts to create the content. And at the end of this section, I'll give the do's and don'ts of using ChatGPT or any other LLM for content creation. But as you all probably know, healthcare marketers aren't always subject matter experts. You might have more depth in the field than some people, but you're not a true, healthcare provider who knows conditions inside and out. And especially when you work for a large hospital system or network that has a ton of different specialties, it's difficult understanding them all to the degree that you need to create content. So we use this content brief Kickstarter in a lot of cases to expedite our work. So for this example, say we want to make a page on choosing a heart doctor, a nice educational piece of what you should consider when finding a heart doctor. All we really have to do is put in a keyword. We can give it more context of what we're looking for and the elements that should be on the page, but we have to pass this off to writers, and the custom GPT knows to give us the objective of the page, the tone they should write with, all the key points to cover, and then even produce a heading wireframe that they can start with. Like I'll go into on the next slide, we have a lot of do's and don'ts of using it to create content, but you can already see just from that it does understand that audience's needs pretty well. It does know that you're looking for experience. It knows that you should look at referrals and reviews and patient feedback, or give you questions to ask your cardiologist if you're considering them. In my experience, these aren't perfect, but they are almost perfect. They're a really good kickstart to get your content started. And you can tailor this to be an email campaign or social media ads or a social media post. But really, you can just put in a topic. It has a ton of knowledge on that specific condition and people who are looking for a healthcare provider in that field. But if you haven't used ChatGPT yet for this kind of stuff, and you can use Gemini or another model, but I would definitely give it a shot. It knows a lot about different conditions and what patients go through and what they care about most when choosing, a cardiologist versus a physical therapist or something like that. So on the next slide, we have some do's and don'ts. First, don't use AI generated content for healthcare without a rigorous review. I feel like I shouldn't have to say that, but we don't want AI to be giving healthcare advice. The farthest we really take it is getting our outline started, then we come in and review it thoroughly before passing it off to writers who work with healthcare experts to actually craft the content. But we don't want AI giving healthcare advice, but we can use it to give us some information to work into our page or even give us an outline of the direction it should be going. The next one. So similarly, don't use it to draft entire pages. Like I said, you don't want it giving healthcare advice, but also people are getting better at understanding when it's written by AI, and that can really undermine your audience's trust and show some insincerity. But I wouldn't trust it wholeheartedly with its recommendations or the content it creates. So I really wouldn't use it as a content writer, but I would use it as an assistant, something that can get you started, pull together some research and recommendations, but then always use your expertise and lean on healthcare providers and subject matter experts to actually craft the content. The next one, so don't use AI for data to support your claims. You can feed it data, like I said in the previous one, where you give it the data and then you're just kind of querying it. But I wouldn't ask it out of the blue for specific data, like in different countries or anything like that. It'll hallucinate. If it doesn't have the answer, it'll act like it does. So it'll often give misinformation or inaccurate information. So I wouldn't use it for data to support claims, but I would use it to help, generally guide your piece. The next one, I've already kind of hit on this one, but don't replace content writers or subject matter experts with AI, but I would use it as an assistant when tailoring a piece or when getting it started. So the do's are already things I've kind of covered, but do use it to learn more about specific topics, conditions, treatment options. It knows a lot about a lot. So you can ask it for information about, how do I speak to someone with this specific disease, or what are the treatment options for this condition? Even then, I would still lean on medical experts and do your own research to confirm it. But it can save you a lot of time in the beginning of a project by just using its knowledge base and telling it to give you an output that you need. Um, so the next one, I've already talked about this one too, but do use it to learn more about specific audiences. Um, the next one, so while we don't want to have it create content start to finish, I do often use it to brainstorm specific short blurbs of copy. So a call to action, for example, to conclude a page, I'll often say, I'm writing a page on X for this kind of a company. I need an impactful call to action to conclude the page that drives people to our Find a Doctor page. And then I'll say create 10 different CTAs with that in mind. And they're not perfect, but they are a fantastic brainstorming tool. Um, so yeah, I would use it for like specific blurbs, even headings or ad copy. Most of the time you'll find it's not perfect, but it gets you a lot of ideas and can really get the ball rolling. Like I said before, use it as an assistant. Things that could be done by a well-trained intern could be done by ChatGPT in many cases. So ChatGPT is better the more context you give it and the more specific your directions are. So imagine you're typing out a to-do list for an intern. You're saying, I want you to look up these specific topics. Tell me, what they care about most, what content should be on the page, draft a call to action. If you put that information into your prompt, ChatGPT usually gives a pretty good response on the output. But so think of it like an assistant, similar to an intern or an untrained professional. It's not going to be your subject matter expert, but it can be a nice research assistant or someone that gets you 90% of the way there, and then you take it the final 10% and leverage your expertise from there. And then the last one, anytime you're using ChatGPT, make sure you have a strict review process, especially for healthcare. But you never want to rely on ChatGPT as a, as a healthcare provider. You don't want to give it your symptoms and say, what do I have? So anytime you are using it, make sure you're also using a strict review process. But if you do all this, you can certainly save a lot of time getting a lot of work done by leaning on ChatGPT as an assistant. So those are a few of our use cases. We had a local LLM. We had a search scraper. We have it as a knowledge assistant and a content brief starter that you can use for social and everything else. Now we're going to talk about a few tips for maintaining HIPAA compliance. And again, this is not legal advice. On the next slide, you'll see that if you work in healthcare, your organization should already have a HIPAA compliance policy. So anytime you're evaluating a tool or you're going to start using an LLM, definitely consult your privacy team first. Don't just rely on these do's and don'ts, but we do have a list of do's and don'ts that make it easy to understand how you can stay HIPAA compliant and what is clearly over the line. So first, the do's, data minimization. So use the minimum amount of data necessary to work with these tools. So if you have, Salesforce data or patient data, if you don't need the personally identifiable information, you don't need the protected health information, don't feed it into the tool. The ways that I just covered, understanding your audience and, that content brief Kickstarter, we don't use any customer data. We simply use it to learn more about topics and specific audiences, but we're not feeding in PHI, so it's not going to be in breach of HIPAA. The next one, so if you do have to use PHI for some reason, say you're optimizing social media campaigns and you're using your first party customer data, you can encrypt it or essentially replace it, but there are ways to encrypt your data in a way that'll keep it HIPAA compliant. But if at all possible, don't use PHI when you're working with a tool like this. The next one is similar. It's de-identifying your PHI. So if you are going to use it in an AI tool, you can de-identify it in a way that you're not actually connecting, the patient, their specific information with their conditions. you can use kind of your own code to, hide the PHI. But again, if it's not necessary, don't use it. You can try to minimize the data you're using when you're working with one of these tools so that you avoid any HIPAA concerns. The next few are more general about maintaining HIPAA compliance, but if you work with a team and you're trying to get more people to use it, training and education is key. So just like you're here learning about using AI tools for healthcare marketing, you want to do a similar training with your team and any new person that joins and make them regular. So you keep people up to date over time, keep educating them, and make sure they know the safeguards to maintain HIPAA compliance. Access controls are also very important. So if you don't need PHI, you shouldn't have access to it. That's generally an organizational rule, but especially when it comes to an AI tool like this, making sure that you limit access and that you know exactly who has access is going to be key. You don't want to just grant organization-wide access to tools like this with people who have PHI and haven't been trained thoroughly. And just like any tool, regular audits and monitoring are key. So make sure, even if you have trained people up and you've given them access to tools, make sure you regularly audit what they're using it for, their use cases, and you're catching any potential HIPAA leaks that you might have. The don'ts are pretty similar. Don't use PHI unless absolutely necessary. So that's one of the biggest keys is there's only so many use cases you need PHI or that it'll come into play with. And if that is the case, I'd recommend a local LLM like we talked through in the first example. So a local LLM is where you have all the controls. You're not feeding that directly to ChatGPT. You're doing that all in-house on your local server. So if you do have a case where you know there's going to be PHI that's going to hit the tool, build it locally. If you want, you can reach out to us afterward and we can talk you through it or have a meeting to discuss it. But if you do have a use case where you know PHI is going to be in the input somewhere, then build it locally so that way you're not sending it to OpenAI, you're processing all that in-house. So don't connect your tools directly to AI. And by tools, I mean if you have PHI. So if you are going to connect Salesforce to an LLM, you can do that locally, but don't ever use an API that connects a PHI source to an LLM. Don't share access unnecessarily. So anyone who is going to be able to have access to PHI, that should be monitored and audited. Same thing with an LLM. So anytime someone is using that, make sure you know who's using it and what they're using it for. Don't overlook third-party compliance. So any third-party vendor of AI, make sure that either they are HIPAA compliant or you're not using it in a way that'll give them PHI. These tools are really popular. There's different, AI note takers that can save you time, but make sure you thoroughly vet them and that you fully think through if you're going to be on meetings where people are discussing PHI and then you have an AI note taker that's taking all these notes, writing down their name and their conditions, that can be a HIPAA violation. So make sure you don't overlook third-party compliance and that any tool that you decide to use, you thoroughly vet and think about the use cases you have. Similarly, don't use unverified ones. There are so many ChatGPT extensions that are getting spun up. Make sure you don't use anything unverified and that you go through strict review processes before you start a new tool. And like anything else, make sure you document everything every step of the way. So what you're using it for, what you're using, how you're going to be reviewing and auditing, all these are critical when maintaining HIPAA compliance. That was a lot of me talking about HIPAA compliance, but definitely important for anyone in healthcare. I'll pass it back to Max to talk about how you can earn buy-in for AI at your organization.
Thank you, Taylor. All right, so to round out our presentation, we found that seeking buy-in from skeptical stakeholders continues to be a challenge amongst our clients. So we thought we'd share a few slides on concepts and ideas we found to make this process a lot easier. The first one is that while AI can significantly enhance efficiency and accuracy in marketing, it's also crucial to consider potential complications such as HIPAA compliance, setup challenges, and the ongoing costs and maintenance. So don't be afraid to ask yourself if that's something that's really needed. Also, we also recommend starting small with focused projects to quickly demonstrate value. So define clear, smart goals that are measurable and time bound. With each success, we recommend documenting that and scaling up. If you have a whole roster of success, it's a lot easier to go forward with that than kind of starting off with a really big project. Tailor your AI project pitches to match your organization's culture and audience. So for your CTO, you'll want to focus on the technical benefits, but your chief compliance officer is going to be pretty concerned about regulatory adherence and data privacy. Successful AI implementation in healthcare also does hinge on cross department collaboration, shared ownership, and against strict HIPAA compliance. And then lastly, we recommend utilizing external expertise and ensuring accuracy. These are critical for successful adoption of AI and healthcare marketing. So with that, we've got a few minutes to kind of open it up to any questions, if anybody has any questions. I don't know if there's anything in the Q&A yet.
No, nothing in there right now. I would throw out if anyone does have questions following, you can reach out to us. You should be able to reach out through the email that we sent to set this up, or you can find us, on LinkedIn. But I'm always happy to talk AI, especially content marketing, or anything else. But if anything did pique your interest, feel free to reach out to us, and we're happy to talk more. Seeing some come in now. Max or Paul, I don't know if you can field the first one on an SLM for healthcare, but
I feel like that might be a Paul one. Paul, if you want to answer that.
I know I can speak to the second one. Do we have any market data benchmarks or other sources that can show how companies are using AI in healthcare marketing and how it's going? So I'm sure we can find more case studies and whatnot online. I know personally from our clients, we've used that content brief Kickstarter to create web pages, and they are really successful. They get picked up in search well, they get a lot of engagement, and I credit most of that to the fact that and I guess too, we've used it for social media campaigns and ad copy. I credit most of it to the fact that we're not copying and pasting directly from ChatGPT. We are using it as a brainstorming device and then using our expertise from there. I don't necessarily have benchmarks, but I know for my specific clients, I can pull click-through rates and conversion rates and time on page and things like that. But I do know it's been successful when we use it as a research tool and then we layer in our expertise. I don't really have any data on just out of the box trusting AI to write your content.
Another question says, hi, how do we ensure privacy in LLM models? The first example that we had was a private LLM. So it's secured in a local environment, and it's not that data that we send over there is not sent back over to OpenAI. Additionally, like if you are going to work with someone like ChatGPT or Gemini, we would again just recommend making sure that there's no PHI or PII within that data.
Yeah, you really can't trust the out of the box solutions, but you can build your own private ones. So if you do have, like I remember early on, Samsung's developers were feeding code to ChatGPT, and then they were surprised to learn that ChatGPT was giving that code out, that proprietary code, to other people who were asking. So if you have anything that is, confidential that you don't want getting out, I would use a private LLM and set one up like we did for that inbox monitoring use case. But if it is anything where it's not protected information, like you're brainstorming ideas, learning about, I guess the more you're trying to get out of ChatGPT and less of you feeding it personal information, that's okay to use out of the box ones. But anything where you're giving it confidential stuff, definitely use a private LLM. I know Paul is answering some of these questions right in the chat, so keep an eye on that if that answers any of your questions.
We will have the slides available at the end of this. I believe on the same webpage that we could sign up. You could sign up on our website. I might be wrong on where it will be, but it will be available.
And Paul, I like your answer to the Meta Llama question. I personally don't trust Meta with too much. So yeah, especially with healthcare, I would not trust that. Um, and I would even go as far as saying if you have a use case, if you're evaluating these, go test them all out. Could take a couple hours and craft a few different questions, and then ask them to each, Gemini, ChatGPT, Llama, any other ones, and do your own research and see how effective you think it is. Fact check them, but do some initial research in your use cases and then evaluate the responses yourself and see how you like it. That's what we were doing in the beginning. We were testing all different models, settled on a few for different use cases, but I know for what I need, the ChatGPT, the latest models have been pretty good. But if you have even more information you needed to digest, you might want to go with a Claude or something that can process bigger amounts of data. What do we have? I think that's all of them. I believe Paul has answered everything so far. We are going to share the slides and the recording from the video. And again, if anything comes up after or you want to see a walkthrough of something, feel free to reach out to us. We're always happy to help. So yeah, find us on LinkedIn or reach out through our website, and we'd be happy to talk more. All right.
All right, sweet. Thank you for joining.
Yeah, thank you all. Bye.